And in November 2024, a young woman we shall call Ainafe James from Bvumbwe in Thyolo walked through the valley of the shadow of death. She procured an unsafe abortion. James says at the time she was married and they had a 3-year-old child. Since the family was not taking family planning methods, James got pregnant again. This did not please her husband, who vanished in the thin air and never returned. This made James to struggle and wrestle with thoughts of how she would take care of the baby alone once the baby was born. She explored options, and her only way out, she thought, was abortion. She took home remedies, aloe vera mixed with over-the-counter painkillers. After 7 days, she faced death as she fainted, but some people rushed her to the hospital where medical personnel assisted her. However, that was not the end of the story, since she lived in the area where bylaws were clear on those procuring unsafe abortions. The culprits must pay a fine of 100,000 kwacha. The group village head woman got wind of what had happened, and she was told in no terms to pay.
Natenga luvera ndamuvika kumazi ndapita ku grocery ndagula mankhwala ndinakhala sikumelo ndakhala bwino bwino popanda vuto nalilonse pa wiki inadithera ndi siku lina nangona chizungulire chanapita ndagwa pasi ndiye kumene kuja kuchipata kuja natithandiza ndapeza atatulukako ndiye ndizabwere nokuno ndipamene tinayitanidwa kuno kwa mfumu afotokozedwa kuti
Village head woman William too says the issue fines to anyone who defies the law, adding that this is promoting education and saving lives of young women and adolescents. AGYW.
Senior Chief Bvumbwe tinapanga malamulo kuti amene atapezeke atangochosa mimba mopanda dongoso nalilonse ameneyo azipereka chindapusa chake njonoko kuti akumalipira ndalama yokwana 100,000.
This is evident that the country's restrictive laws are not deterring women and girls from seeking abortions. Instead, they are pushing them towards difficult procedures and draining public resources. This case serves as a reminder of the urgent need for comprehensive reproductive health education, as well as increased access to contraceptives. The Minister of Health identifies backstreet abortion as one of the top 3 killers of pregnant women, accounting for 18 in every 100 maternal deaths in the country. In one of the country's publications, Platform for Investigative Journalism, PIJ, Adrian Chikumbe, the Minister of Health's spokesperson, said health centers assist 2 or 3 clients weekly, while district hospitals handle an average of 7. Chikumbe noted that delays in seeking medical services make the treatment of abortion complications difficult and costly. Chikumbe referenced a 2015 study showing the cost of various procedures, dilation and curettage, DNC, a procedure to remove residual tissue from the uterus, cost 109,000 kwacha, about $63. Manual vacuum aspiration cost $49. Simple post-abortion care cost $13, and treating several complications cost $128. Meanwhile, in a quest to reverse the trend, a Kodakoda-based NGO, Women Rights Institute, WORI, has been implementing a year-long project in the area of Senior Chief Bvumbwe in Thyolo district, advocating for increased access to sexual and reproductive health SRH services among adolescent girls and young women, while popularizing SRHR policies in the area. This was the 32,000 euros, approximately 66 million kwacha project, which is phasing out by the end of May 2025. A needs assessment that was conducted in the district revealed that at least 662 AGYWs procured unsafe abortions at Bvumbwe Health Center and district health facilities from January to September 2024. It further found that the complicated abortions were largely due to privacy, traditional and religious beliefs, and poor communication between parents and young people on sexual reproductive health rights issues. The district's youth-friendly health services coordinator, Steve Dimba, agreed that the findings mirrored the situation on the ground, attributing them to low uptake of contraceptive methods.
Reduced uptake of youth-friendly health services by young people. So no wonder there is also an increase in terms of unsafe abortions. So yeah, like I said, the data is speaking on its own.
To address the challenge, the project targeted interventions on capacity building, community engagement, and advocated for improvements in the sexual reproductive health service delivery infrastructure. Meanwhile, communities in the area have lauded the initiative. Bvumbwe Area Development Committee ADC Chairperson Maulidi Kalewe says there has been a tremendous improvement on issues of unsafe abortions and access to sexual reproductive health services.
Kubwera kwa oli ena swasikana kuchimvesesa okamene ayamba kusipereka kunena kuti ine ndikufuna ntabwereraso ku sukulu ndini mwana ndiye akulandira mauphungu akalandira mauphungu mapeto aja kutha kubwerera ku sukulu ndiye tikutha kuona kuti oli yatibweresera zinthu zabwino komanso patsogolo pake tizakhala tikuimba zokoma kuposera pakali pano kuti zinthu zizangoyamba kwazikoni kuti zili ndi tsogolo labwino kumene tizikupita.
Similarly, Kaunika Women Group Chairperson Lonely Mbalangwe believes this is promoting good health and education after they are readmitting several girls, including 2 underage learners from Chide village who dropped out of school and ventured into sex work.
Gulu lathu likuti likhala kuunika cholinga choti tiziunikira atsikana ochuluka tindatsikana ambiri amene tikugwira nawo ntchito komanso achitsikana amene atengapo mimba komanso tikubwezeresa achitsikana ku sukulu kuti akatenga mimba kubereka mwana sizinathere pompo.
Bvumbwe Mother Group Chairperson Susan Tsimenti also shares her experience of working with young women in the intervention.
Anatu achinyamata atu wauza za kuipa kugona masasiteteza kuti ngati zonseza ataona kunena kuti no sizikwavuta kuli bwino atha kupeza njira yotani yolera kuchipatala kuti mwena azikhala.
In the project, peer educators have also been instrumental in creating demand, and Bridget Muhone is one of them from Tunga area.
Tinaimbipa zambiri zatsikana mene akataya mimba kumano panopa zinachipa ana mbiri akwanisa kuziteteza komanso akwanisa kusunga mimba ngati yabwera.
Senior Chief Nkosi Bvumbwe says under the project, they managed to formulate the bylaws which have reduced unsafe abortions, home deliveries, and early marriages.
Kuzana ndi Mother Group komanso achipatala chifukwa anthu amaberekera panjira amangopita kuchipatala kapereka ndalama akachoka kumene koko akamabwerera amayankhula mawu chipombo tunazoti ayang'aneni ife ndinapita kuchipatala akapereka ndalama tabwereranso mapeto ake zimakhala zinthu zotani pa malamulo ayina kuti agwire ntchito kuti kuchina chilichonse chena kugwira ntchito mogwirizana ndi lamulo pamene ndilini pano ndimaopaso lamulo ino lo mwana wanga sangaberekere panjira sizingatheka olakazi anga sangaberekere panjira.
Meanwhile, Worry Programs Officer Chisomo Paiya says with support from Amplify Change, they have for a year managed to reach to over 1,500 adolescent girls and young women with sexual reproductive health messages, including promoting access to post-abortion care.
We can point at many achievements we have encountered so far. We see that there is an increased access to SRHR services among adolescent girls and young women, and also there are a lot of girls networks that have been formed in various group village heads, especially the whole area of Bvumbwe. There are more networks of adolescent girls and young women, and also boys have also joined the girls in protecting their rights and also making sure that they access these services. So it's a great achievement, and also it's a great change to the community. And we have also seen that there is collaboration within the community structures. People are working together in this implementation. The local structures, they are able to support the girls.
Although the country gained independence in 1964, it still upholds several colonial era laws, including Section 149 to 151 of the Penal Code, which prohibit attempts to procure an abortion except when the woman's life is in danger. Specifically, Section 149 states that anyone who attempts to cause a miscarriage through administering poison, using force, or any other means whether the woman is pregnant or not, shall be guilty of a felony and liable to imprisonment of up to 14 years. Malawi's restrictive abortion laws contradicts the 2013 Gender Equality Act, which guarantees every woman and girl access to comprehensive sexual and reproductive health services. However, there seems to be some sort of hypocrisy as Malawi ratified the Maputo Protocol to the African Charter on Human and People's Rights on the Rights of Women in Africa, which guarantees comprehensive sexual and reproductive health rights, including safe abortion.